I grew up in Kiwanis, Indiana.
I'm originally from Duggar, Indiana. It's a really small town. What brings you in today?
Dustin Ellis is a young doctor who wants to practice in rural Indiana.
Hey, Matt. How are you doing today?
So too is Jennifer Mullencup.
What brings you in to see me today?
The two small-town doctors are graduates of the Rural Health Scholars Program at Indiana State and Indiana universities, a program that has led to creation of the Rural Health Innovation Collaborative to address shortages in all areas of healthcare in smaller communities.
I take care of children and their grandpa and their uncle, and you take care of the whole family, which is a really neat experience.
Just breathe normal for me. I had a few reservations, I guess, about coming home to practice medicine and wonder whether people will be comfortable seeing me, and already seen a ton of familiar faces on a daily basis, and it seems as though people prefer to be taken care of by one of their own if it's a possibility, so it's been really good.
I knew I wanted to go into medicine. I didn't know the road to take to get there. I had a very good advisor who really helped me out and sort of helped me, get through deciding what was the best path for me to get my eventual goals.
See, the problem is she's bleeding. She's not deep, but see how she's gaped?
Yeah.
One of the most valuable parts of the program was the exposure to rural medicine that you get when you're an undergraduate. So not too many students get to spend time shadowing physicians and spending time in rural critical access hospitals. You can kind of see what it's really all about to be a rural physician.
That's a herniated disc.
The Rural Health Innovation Collaborative is working to expand the unique brand of training to other healthcare fields at Indiana State and at Ivy Tech Community College.
Really get this interprofessional education going so the different healthcare providers understand the capabilities and understand the experiences that those other professions went through to get their licenses.
Think about the things that you would be assessing, and then also what would be important to communicate with her physician as far as her care goes. So
what do you find in there?
So what I'm doing is if I'm suspecting an ankle injury, I'm going to start palpating away from the injury.
It's important for all of us to work together because patient care should be our #1 priority. And if we can't communicate effectively to meet the goals that each other has for a particular patient, then we're not going to be able to effectively care for them.
Go ahead and turn them over so you can listen to the posterior side.
Okay, thanks. Just having access to healthcare is something that's really important. Something that I don't think I really even realized until I started nursing school is a lot of people don't have a hospital that's close, and so by the time that they need to get there, the problems may have gotten a lot worse than they needed to.
What the Rural Healthcare Innovation Collaboration has allowed us to do is to look at all the shortages for all the healthcare providers so that we've got the right healthcare providers at the right location at the right time.
The Healthcare Collaborative could also be the spark that helps revitalize a Terre Haute neighborhood.
We think it'll be a driver for new job creation. It'll be a driver for attracting new students to our community, to Indiana State and to Ivy Tech, and also a driver for about a 200-acre redevelopment area between the ISU and Union Hospital campuses.
The Collaborative's goals of making Terre Haute an even greater center for rural health care and neighborhood revitalization have overwhelming support.
Knowing that there's a program that exists that's specifically for you coming from a rural area, I think is a reassuring thing that it's a possibility and that it is doable to come from an incredibly small town and still go to medical school and become a physician.